really appreciate you. Accreditation is not supposed to be a trick. It's not supposed to be a gotcha sort of thing. So let me talk about how we view accreditation and the history of URAC here. So go ahead, next slide, please, Lisa. So URAC was founded back in 1990. We are a not-for-profit. We are independent. We see our role as validating quality throughout the healthcare landscape. One of the things that's really important about us is that we are probably the accreditor who worries the most about making sure that we have strong integrity in what we do. Therefore, we don't sell you consulting services. We don't think that if you're going through accreditation, you should have to pay for a bunch of consulting hours from the accreditor. We think that's a conflict of interest. We also don't control measures and sell measure sets and those sort of things, because if you own measures, you tend to stick them into your programs and make people pay for things twice. So we really say that here at URAC, being the most complete healthcare accreditor, we're going to be not for profit. We're not going to sell consulting services. We're going to have really clear and honest transparency with the things that we do. So if you buy an accreditation, you're going to pay for that accreditation service, and that service is going to be educational. We're not going to do any tricks, and our goal is not to have you be high quality the day that we show up. It's to set you up to be high quality every day, to serve the people that you serve day in and day out. Next slide, Lisa. So when we talk about accreditation, accreditation is more than regulation. The way we see things, regulation sets the bar for safety. Regulation tends to be the regulators, the federal government, the state government, those sort of things. But accreditation is really setting the bar for quality. When I was a physician, I would get my license from the state, but I was board certified, and that was the higher mark of greater quality that I chose to do when I was a physician. And to be accredited by URAC means that you're not just doing the bare minimum, you're not just getting by, but you're working with an accreditor who has been around for a long period of time and who really wants to make sure that you're meeting quality for all the people that you interact with. Next slide, please. Now, when we talk about accreditation, I've touched on some of these things before. Accreditation is not simply checking the box or buying the standards or those sort of things, or paying enough consulting hours that somebody blesses the work that you do. It really is about equipping an organization to have a quality framework for all that they do. It's intended to ensure continuous quality improvement. We update our standards. We move people along. We don't just do the bare minimum. We're showing what is extra. And then it's independent third-party verification of a quality program. We're an independent organization. We're not an arm of a pharmacy system or a doctor system or those sort of things. We are independent, and since 1990, we have been just being about quality and making sure that patients get the best care that they can. And in some places, accreditation is required. It's you have to be accredited to do such and such thing. But in a lot of areas, accreditation is sort of that extra that I use the analogy, and eventually I'll probably get yelled at about this, but it's sort of the good housekeeping seal of approval. It's the Angie's List or Better Business Bureau. You're doing more than simply the bare minimum, and it makes we're holding you accountable for being more than just that. And leaders and people who want to distinguish themselves in the marketplace often use accreditation. So we were at Assembia recently, and if you went around to Assembia, some of the larger organizations had a plaque basically on their booth that says they are URAC accredited, to demonstrate that they are doing more than the bare minimum. They're going above and beyond to make sure that their care is the best.